Thank you for investing the time to review this recorded session entitled Supporting Students and Families Through Behavioral Health Resource Coordination. This session was prepared for you by the team at the Behavioral Health in Education Resources and Opportunities Technical Assistance Center. We call this center BeHero. At BeHero, we believe that understanding the behavioral health needs of students is the first step toward building healthier, happier schools and communities. Through training, technical assistance, and collaborative opportunities focused on evidence-based content, we help behavioral health resource coordinators across North Dakota support the well-being of students and their families. I'm Lindsay Engstrom, Director at BeHero and staff member at the Central Regional Education Association, one of North Dakota's 7 regional education associations. Before I formally introduce BeHero and speak to the role of behavioral health resource coordination, I'd like to provide a little more context as to how BeHero came to be. Many of us can recall the 2019 Governor's Summit on Innovative Education when Pam Sagnis, Director of the North Dakota Department of Human Services Behavioral Health Division, in collaboration with Superintendent Kirsten Basler from the North Dakota Department of Public Instruction, addressed attendees, citing the vision of a sustainable behavioral health system addressing the full continuum of care. In order to achieve this vision, the mission began with establishing strategic goals, growing an understanding of the continuum of care, and understanding how that continuum of care can look across previously siloed systems. Since multiple forms of support have been made available to North Dakota schools, including a prevention and early intervention pilot school grant. This support was established for the purpose of developing a pilot project that demonstrates improvement in children's behavioral health in a school setting. The goal of this project has been and continues to be to learn with schools how a fully integrated continuum can look across various North Dakota public school settings, suburban, rural, and with a tribal context. Simile Middle School was awarded the initial support in October of 2018, and since 2 additional schools, Dunseith and Barnes County North, have been awarded the support. Behavioral health school grant funding was another support made available for public or private schools who utilized the North Dakota State Medicaid reimbursement plan during the previous school year and submitted a plan to the Department of Human Services detailing collaboration with other regional school districts regarding student behavioral health needs and the use of grant funds to develop interventions for student behavioral health needs. In addition to these supports, support for behavioral health resource coordinator training and technical assistance has been initiated and is what we'll spend most of the rest of our time together talking about today. We would be remiss if we didn't acknowledge that the development of the previously mentioned support was made available by the North Dakota Legislature's commitment to North Dakota children and families. This commitment was renewed during the 2021 legislative session and is evidenced by the continued fiscal resource allocation for the Prevention and Early Intervention School Pilot Grant, Behavioral Health School Funding, and Behavioral Health Resource Coordinator Training and Technical Assistance. Let's elaborate on Behavioral Health Resource Coordinator support. In 2019, it was established that every K-12 school building would designate one individual to serve as a behavioral health resource coordinator. It was also established that the Department of Human Services Behavioral Health Division would provide resources and opportunities for each behavioral health resource coordinator at each school. Behavioral health resource coordination brings an opportunity for cross-sector collaboration, integrating human services and education, keeping students and families at the core, while working toward achieving the strategic vision or goals within each sector. Additionally, both sectors have similar ways of thinking through support, similar frameworks, the behavioral health continuum of care, and a multi-tiered system of support allow alignment and serve as facilitators for this collaborative effort. From an educator's perspective, an oversimplified way of thinking about a multi-tiered system of support or thinking about these frameworks might be something like the process that school personnel use to support academic, behavioral, social, emotional needs of all students. The Behavioral Health in Education Resources and Opportunities Technical Assistance Center, BHERO, was formed to facilitate this strategic collaboration. At BHERO, we are a group of educators and advocates who are passionate about the importance of behavioral health in our schools and communities. We believe that understanding the behavioral health needs of students is the first step toward building healthier, happier communities. BHERO provides technical assistance and shares weekly messages filled with evidence-based content and collaborative opportunities addressing the behavioral health topics that are most important to today's educators. Our job is to help school personnel stop the cycle of behavioral health stigma and avoid burnout. Together, we can start building healthier, happier schools and communities across North Dakota. How do we do this? Through one integral role, the Behavioral Health Resource Coordinator. It is the intention that a myriad of critical stakeholders are impacted through the curated resources and opportunities endorsed by BHERO. School personnel, both certified administrators and teachers and non-certified paraprofessionals, bus drivers, school nutrition staff, students themselves, caregivers and their family members, community, school board members, partners, neighbors are all critical stakeholders in this work. Behavioral health resource coordinators serve as the point of contact within each school for resources and opportunities. We know that providing colleagues, students, and their families, and other stakeholders with behavioral health resource coordinators is a huge undertaking for one person. And as school staff members, behavioral health resource coordinators already have enough on their plates. The BHERO resource and opportunity curation and endorsement process is designed to take away the much needed time that it takes to go searching for those resources. Rather, behavioral health resource coordinators can analyze resources and opportunities that's sent to them with a critical eye and triage who might be served best by each item. If you are the behavioral health resource coordinator, you are not alone. You're part of a community of 315 unique behavioral health resource coordinators across North Dakota with knowledge, expertise, and experience to share. The BHERO Technical Assistance Center staff are here to help facilitate additional increased opportunities for connections during the coming school year. If you are the behavioral health resource coordinator, you've already been added to our contact list. You should already be receiving weekly messages, at least during the school year, and monthly messages throughout the summer. If you aren't a behavioral health resource coordinator, please consider inquiring as to who currently holds that role within your school. Please remember, expectations for this role and the process for sharing information is likely still in development. Behavioral health resource coordination is new to everyone, including behavioral health resource coordinators. Regardless of your role, behavioral health resource coordinator or not, we can all choose to be a part of the momentum. This movement is worth the wait and worth the work. The best is yet to come. In the interim, please feel free to send inquiries or requests to bhero.crea@k12.nd.us. BHERO's web portal is anticipated to launch in the fall of 2021. Soon, we will have access to curated resources available for all to access at www.b/hero.org. On behalf of our BHERO team, we look forward to serving critical stakeholders through behavioral health resource coordinators in the coming school year.